Basic first aid. In this video, we will learn what first aid is, what to include in a first aid kit, and how we can provide first aid in case of common injuries and accidents. How many times have you cut your finger while chopping vegetables or suffered a stovetop burn while cooking? Minor injuries happen every day, and most are easy to treat at home. But to handle them quickly and calmly, you need to know what to do. First aid is the immediate help that is provided to an injured person until full medical treatment is available. A first aid kit is a must-have for treating minor accidents, and it should be stocked with supplies such as a thermometer, bandages and adhesive tape, sterile gauze, antiseptic liquid, antibiotic cream, some painkillers, burn cream, scissors, and tweezers. Now let's see how you can give first aid in some common scenarios. Sia and Mona are having coffee on their balcony when Sia is stung by a wasp on her arm. She cries out in pain and notices that a little bump has formed. Insect bites and stings are common and don't usually need treatment. But a sting from a bee or wasp can be serious. To take care of an insect bite or sting, remove the stinger by gently scraping a half-cut onion across the person's skin. Wash the affected area with soap and water and apply ice over it. This would help reduce pain and swelling. Finally, apply a paste of baking soda and water several times a day until the symptoms disappear. You know how important it is to keep children away from household things like disinfectants, cleaners, and even medicines. Kids may unknowingly swallow these substances or apply them on their skin. These can lead to poisoning and cause symptoms like vomiting, fainting, and troubled breathing. They may also cause skin rashes or burning eyes. If there's poison on the skin, remove any contaminated clothing and wash the skin for 15 to 20 minutes under running water. If the poison, chemical, or its fumes have entered the eyes, rinse them with water for at least 15 minutes and see a doctor immediately if irritation persists. Now let's see what to do in case of a nosebleed. Nosebleeds look alarming, but they can be easily treated. Lean the person's head forward slightly. Using a clean washcloth, gently press the nostrils together and hold for 5 minutes. Burns in the kitchen are common, and they must be taken care of quickly.
Ma, I burnt my fingers. I didn't realize the pot would be so hot.
Oh, Neil. Come, quickly place your hand under cool running water for at least 5 minutes. I'll apply some burn cream.
Never pop burn blisters or rub oil on the burn. These can cause skin damage and infection. Outside the home, road accidents frequently happen, but if help is provided immediately, many lives can be saved. When you see an accident, don't walk away. Help the victim like Rohan and Samar do.
Look, Samar, that man just fell off his bike.
Oh, we must move him away from traffic immediately.
My God, he's bleeding.
Here, I'll control it by tying the area above the wound with a cloth.
Yes, and I will call the ambulance.
If the person is not breathing, he should be given CPR. That is, cardiopulmonary resuscitation. Place the heel of one of your hands in the center of their chest. Put your other hand on top of the first. Interlock your fingers so they're drawn up and the heel of your hand remains steady on their chest. Now push straight down on their chest repeatedly, allowing their chest to recoil between compressions. You may also need to give mouth-to-mouth resuscitation. Remember, it is best to avoid accidents, but when they do occur, stay calm and give the injured person basic first aid before help arrives.